Hey, hello everyone, and welcome to yet another Tooth Talk with your dentist on thedentaire.com. I'm Dr. Rekha, and the Tooth Talk with your dentist is an initiative to increase oral and dental health awareness among people. Do visit our website www.thedentaire.com to get more information about your dental health. Subscribe to our YouTube channel, and you can follow us on Facebook, Twitter, Instagram, and on Telegram. And in conversation with me today on the Tooth Talk, I have Dr. Niketh. To give you a brief introduction about Dr. Niketh, Dr. Niketh started his journey as a dental professional in the year 2001 and has over 20 years of experience in the field of dentistry. He is the co-founder and the mentor at Densman Practice Management Services since 2015. Densman Practice Management Services is the first of its kind in India to cater to dental practice management training for dentists. Here, Dr. Niketh and his team trains dentists on how to set up their practices and the protocols that they need to follow in their dental practices. Currently, he and his team are working on the practical implications of the guidelines given by the Dental Council of India. So let us talk to him and understand his expert opinion on the current situation of dental practice in our country. Hello, Dr. Niketh, and a warm welcome to you on the Tooth Talk with your dentist conversation.
Thank you, Dr. Rekha, for introducing me and allowing me to speak on this platform. Thanks a lot.
Thank you so much. Thank you so much for joining me. So I understand, I think in the past 2-3 months, ever since what happened, the lockdown happened in the country, or rather across the globe, it has happened. And I think very slowly we are getting back to normal. So why, and most of our patients could have been thinking why dentists are still unavailable. Although there was some newspaper release that happened that clinics will be open, still some dentists may not be into active practice. So why do you think some dentists are still unavailable?
That's right. Everywhere, actually, you see dental clinics most of them are actually closed. And I know that people are wondering why is it so? Because authorities have said that doctors should see their general patients, but still, dentists, they are not available in their practices. And this is very commonly we are seeing all over the country. And I think people should know this thing. See, this is a battle, actually the battle of survival. Few people, they are fighting on the war front like our many medico counterparts, and few are helping at the back end like ophthalmologists, pediatricians, gynecologists, and even the dentists. Now these dentists, we all have one problem, and the problem is that we work in a oral cavity where there is a major number of virus titer could be. So we dentists need all the possible equipments to fight this battle. And you know that we were among few who were battling this battle even before the COVID times. You must have seen that
Yes.
even before, unlike our medical counterparts, dental clinics had some rules. Like you
Yes.
can't take your shoes in operatory, your dentist is wearing mask, everybody is wearing head caps. This was way before the COVID-19, right?
Yes.
So we
Yes.
were fighting this from a very, very long time. But now this new enemy of us, which is actually a COVID-19 virus, he is a bit smart, believe me. And for that smart enemy, we need few new things to upgrade. So you remember this thing. There are few things like we need more strict sterilization protocols than before. So for that, we need some new armamentarium. We need more number of people at our practice. But now because of the social distancing, we can't afford to add. So rather we have to work with the reduced man force, and then it is not possible for us to bring all those sterilization protocols in our practice.
Yes.
We need many new gadgets which are capable of eliminating this infection in a better way. But things are closed, so supply is not there. So we are helpless. And one important point is there is a shortage of PPE kits and N95 masks and the other things. Many health workers, police personnel, scientists, research people, they need them more than us. So now
Yes.
it is our moral duty actually to not use those things unnecessarily.
Yes.
What actually you want? You want to have an artificial smile that has to be created by the dentist, or you want a smile actually that would be generated naturally with the news of complete eradication of this virus? So you have to choose one thing. Now we all want our old time back. We
Yes.
want to smile again, and believe me, your dentist is absolutely ready with his equipments to make your teeth look good again. So just
Yes.
have patience. Things will improve. Help our all the medicos and the police people, and Dentists are waiting for supply to start smoothly, and they are waiting for complete availability of the PPE kits and the other equipments, and
Yes.
they are just ready to make the healthier oral cavity again, I think.
So, Dr. Niketh, if you are saying that we still the supply is not in the full flow like the way it should be or it was earlier, then what do you think the patients can expect in a state of a dental emergency? Say in case he has a tooth pain or some such situation. Obviously, it is an unavoidable situation. So, in such a case, what can the patient expect the dentist to do for him?
That's right. See, dentists, they are not available or less available. So when you have some dental problem, then it becomes an issue because we need something immediately as a patient, right? Now,
Yes.
very recently, government has actually classified the dental problems in three categories. One is the emergency. This is a
Yes.
situation where there is an increased life risk, like uncontrolled bleeding is happening from the oral cavity, or there is some extraoral or intraoral swelling which is extending to suppress the breathing. Then it is an emergency procedure. Any accident which can damage your facial bones is an emergency.
Yes.
So these three type of treatments are in emergency, and if you have any one of these three, believe me, every dentist is ready to help you out. Okay. So this is one emergency treatments. Then there is a second category, as government has said, is the urgent. Now this is a category where they have summarized some treatments, their situation, they require a priority care, but that is not life risking. For
Yes.
example, severe dental pain. You have a severe dental pain, बहुत तेज दांत में दर्द है. That means it's an urgent treatment. Maybe your dentist is going to help you out, right?
Yes.
Third molar eruption difficulties, अकल दाढ़ का आना and the pain उसके अंदर होना. That is a most common problem these days. This again is an urgent category.
Yes.
Any abscess, if you have any abscess, कोई pus है, कोई discharge है मुंह से, तो then that is an urgent category.
Yes.
Any dental help you require before any medical procedures. Now, as you know, Dr. Rekha, that these days, before your cardiac procedures, and there are many medical procedures, a dental checkup is mandatory. So if
Mandatory.
you have any such thing you need, then definitely that is an urgent category, right?
Yes. Yes.
Re-cementation of your dental crowns. See, this is a very
Yes.
one common problem because we get most of the calls about these. Like
Yes.
people have some old crowns, they get dislodged. If they keep it for another, say, 1 month or 2 months, then they might be of no
Not fit.
use.
Yes.
You will not be able to cement them properly. So that is under a urgent category.
Yes.
Biopsies. If anybody need a biopsy, then that's an urgent category. I know many people have got their dentures and the removal processes before the lockdown. Now those processes initially they create some ulcers and inflammation, and
Yes.
that is a urgent category.
Yes.
Incomplete RCT. See, you have started. You must have got your RCT's root canal treatment started before the lockdown, and the dentist was not able to uh,
Yes.
finish that. And so he need to change some dressings in between, and that has come into an urgent category now, right? If you have a severe pain, removal of dental caries is a urgent category. Similarly, any dental trauma, if lead to avulsion of a tooth or something, this is an urgent category. Now, these are the urgent category where your dentist will definitely help you. Rest all other, that is the third category, which is elective. Rest all other dental treatment comes in this elective category. So first thing is sure that there are three categories. One as emergency, second is your urgent, and third is elective. Your dentist might delay any treatment which comes under the elective category as per the government guidelines, right?
Yes. Yes.
Now, your dentist will be helping you in emergency category immediately, and he will be booking you for urgent treatment as soon as he get a free slot for you, depending upon the availability.
Yes.
So now we expect something that if you have some problem, so
Yes.
you can do following things. Number one, you contact your dentist immediately on a phone call. Your dentist is ready to listen to your problem on phone. Many dentists they are taking video calls and they are actually trying to judge the problem. Now, if it's an emergency, they will definitely help you. And I advise you, save your dentist number as my dentist in your phone and just give him a call if there is any problem. They
Yes.
will help you on phone. Now, these days, we are getting many calls, many WhatsApp, SMSs. So sometimes it becomes difficult for us to reply immediately. But believe us, we all will call you back as soon as
Yes.
possible if we miss your call or WhatsApp or SMS, right?
Yes. Yes.
Second important thing you need to understand, Dr. Rekha, that if your dentist is not available, He will guide you on phone for the medications, for the precautions, and will give you some instructions. You need to follow them. You need to
Yes.
follow them dedicatedly, right?
Yes. Yes.
Third important thing you need to understand: don't force him to open as he is equally worried. He's
Yes.
not opening because he wishes good health for you. So just help him, right?
Yes.
Fourth
Yes.
thing is, even after having medicines, your problem is say still there. And if your dentist is prepared, he might come to his practice and help you there. And if he
Yes.
is not prepared or he's not ready, might be he will refer you to someone who is now ready to take the patient, right? So you have to
Exactly.
understand this.
Yes.
Fifth thing is, you have to maintain your health, not because dentists are not available, but because this is important to fight against the virus, right?
Yes.
Any old grandma advice, you are more than welcome to follow and share, because our motto is simple: you have to have a healthy teeth and have a good life, right? So few instructions: drink lot of warm water at the regular interval, brush twice a day, rinse your mouth with water with every food intake, eat
Yes.
lots of seasonal fruits, eat healthy food in moderate quantity. Remember this, no extra eating. Be cheerful. Stress,
Correct.
it reduces the immunity, and if you take stress about your any professional problem or any problem, because these days everyone is having that, so
Yes.
nothing is going to improve with your stress. So be cheerful.
Correct.
Maintain hygiene, regularly wash your hands, go out minimum, avoid meeting friends and family immediately after the lockdown is over. Wait and let the things get normal first, right? These are the few things which you need to have in your life, and believe us, we are just a phone call away, right,
Yes.
Africa?
Yes, yes, yes. So I think in these times, probably this more looks like a waiting area. I mean, waiting period where we have to see how this COVID infection is going to, if it's already contained or it's going to spread again or it's going to peak again. So I think this waiting period is a very critical time, and all of us have to be a little cautious and a little careful during these times, and probably do things judiciously.
That's right. That's very right.
So, Dr. Niketh, what do you think? Say, suppose the patients have come back to visit their dentist after the lockdown. Do you think the dentist clinic would look anything different or feel anything different?
This is the question of the millennium, and yes, there would be many changes for patients when they re-enter dental clinics after the lockdown. And believe me, it is not about the dentistry only. Things will change everywhere.
Correct.
Few things they need to be adapted soon. Few things need to be neglected for a better and the safe future. So, dental clinics will have some norms, and I am going to summarize them as per the government guidelines given by our Dental Council of India.
Yes.
They said that there are few guidelines. First, they said that this is the instruction from the government to the patients, right?
Yes.
First guideline given by the government is, they said that dental clinics are open or closed is totally dependent on the local authorities. See, if it's a green zone, orange zone, red zone, doesn't matter. If your local authority allow, then only you will find them open. So call them before you go, right?
Yes.
Second thing is, timings might differ from previous one. See, maybe your dentist earlier, he was seeing you from 9 in the morning to 9 in the evening, but now he might have the different timing. To bear with it and follow the new schedule, you have to follow that new schedule, right?
Yes.
Third, there might be a signboard at the entrance where you will find that anyone having cough, fever, sore throat, sneezing, or shortness of breath for more than 48 hours should reschedule his or her dental appointment, and he need to visit a physician first. So if you
Yes.
have any of these symptoms for say more than 48 hours, meet your physician first, reschedule your dental appointments, right?
Yes.
Fourth, the dentist, he will not be able to see many patients in a day now because of maintaining all those sterilization protocols. His efficiency may go down up to 50 to 60%.
50%. Yes.
So bear with this and take an appointment first before you go to the practice. Fifth, government has decided actually to divide the treatment in three parts, as we said earlier: emergency, urgent, and elective. So speak your dentist about your problem so that he
Yes.
can decide the category for you, and it will
Yes.
help him to avoid an unnecessary visit of yours, right?
Yes. Yes.
Elective category treatment, that has to be avoided at this stage strictly. And if your problem is unsolved, even say after 48 to 72 hours, call your dentist again. That is one thing you can do, right?
Yes.
If there is any symptom of COVID-19, then you are requested to take all the steps of primary care with your physician before scheduling any dental appointment, right?
Yes.
You have to give complete medical history, travel history to your dentist. That is mandatory now. You can't hide that, right?
Yes. Yes.
Cosmetic, non-emergency dental treatment need to be avoided for some time.
Yes.
They will be done, but after some time. Your dentist, he will be recording your temperature at every visit to cooperate with him. Remember this thing, right? You have to give your detailed contact details and addresses to the practice. This is mandatory now. You will find some barriers at the reception and you're requested not to cross those barriers because this is for your safety, this is for your safety of the dental team. So those barriers would be some plastic sheets or something would be there so that reception and the patient may have slight difference in between, right?
Yes.
You are supposed to wear mask every time in the practice and you need to sanitize your hands frequently in the practice and need to remove your shoes before you enter this the dental practice, right? You are also requested to neatly tie your hairs, and this is especially for the ladies. You need to tie your hairs properly when you go to your dental clinic, and please avoid wearing earrings, rings, and carrying bags because your dentist might not allow you to keep your bag here and there in the practice, right? You need to follow the social distancing measures in the practice very strictly. That is very important because you're not supposed to rinse in the spittoon because everybody has seen the dental chair is fitted with a spittoon in along with the dental chair there is there, but you're not supposed to rinse in that spittoon. Rather, you will be asked to use a mouthwash before the procedure, and that you need to do in a regular wash basin at the practice. Avoid touching any door handles, chair handles, curtains, anything in the practice. That is very important. And the last thing that is important is try to give your dental fees online by apps like Google Pay, Beam, Paytm, etc. Cash transaction try to avoid because cash can be a source of infection, right? So these are the few things which will be there when you visit to your dentist again. So follow these instructions and be safe. uh, this is like this you have to maintain for everyone, not even for a dental practice but everywhere wherever you go. These are the basic instructions, and I think these instructions are for our health. It is not for anything else, it is for our health, and we all need to take those instructions very seriously.
Okay. Dr. Niketh, that was a very elaborate set of instructions that you simplified what the DCI has given us the guidelines recently, whatever they released. I think you simplified it so well and said it to our patients. And I'm sure they will be able to understand these guidelines. And I'm sure they will also cooperate with us on this because since all of us are in the current situation now, we all understand each other well.
That's right. That's right. Thank you.
Yeah, thank you. Thank you so much for joining me today. And I really hope I can get you back to talk to our viewers on another topic about dental practice and dentistry.
Definitely, Dr. Khan. I would be
Thank
privileged. Thanks a lot.
you. Thank you so much.
Thank you.
Viewers, that was Dr. Niketh, who did share with us the practical implications of the DCI guidelines that we have got recently on the current dental practice scenario. I hope that talk was helpful. And if you have any doubts or queries, do leave your comments in the comment section below and we will get back to you on that. So until next time that I come back with another dentist on another topic on your dental health, stay safe and be happy. Thank you.